arm moves first, then your torso moves out from underneath your head. This forces your head to suddenly have to accelerate to catch up with the car and your torso. This very sudden acceleration of your head causes 2 points of stress in your neck. The first stress point is at the cervical vertebrae C5 and C6, and the other stress point is between the cervical vertebrae C1 and C2.
We just talked about that.
These 2 areas of our neck usually get the most damaging forces, which oftentimes tears or permanently stretches the ligaments that hold our vertebrae in their proper place.
See what I mean? So this is a close-up view of that facet capsule. And these are like little rubber bands that hold those pillars in place. And you can see where after damage, that synovial fluid can be compromised, and after mechanical stress to that joint, you can have abnormal wear and tear, which turns into almost like facet arthrosis or an arthritis to that little joint that can become painful. Just like a rubber band has like an endpoint, that's what happened with these ligaments. You can obviously have different levels, but these are the lines that we look at on X-ray to see where the normal alignment of vertebrae. But they also are very thick ligaments that hold all those bones together. And you can see them here. There's an anterior longitudinal ligament to the front of the vertebrae. There's a posterior longitudinal ligament. There's small little ligamenta flavum that holds those little facets together. There's interspinous ligaments, and then the posterior aspect of the supraspinal ligaments. But this can be damaged. There's 4 different grades, right? Grade 1 is 25% tear. Grade 2 is 50%. Grade 3 is 75%. That's what we're looking at there, almost a complete tear. But there's different layers. So how deep it goes into depends. But this is all connective tissue, which we're going to get to in a second. Right? So again, we're taking some close-up looks. You can see how these ligaments bend, and when they're not functioning, how you can get abnormal wear and tear, again, on those facets. So, you know, fast forward to 2017, 6 years to the month that I was introduced to soft wave tissue regeneration technology. I had a hand surgery that went terribly wrong, and I basically was out of work for 3 years. I had to stop being a chiropractor, but I was left for 10 years with pain. And April of 2017, I got 3 treatments on my wrist over a 10-day period. I had 90% improvement, and it kind of flipped my whole paradoxical way of thinking on how healing happened. So the coolest thing about this technology, and you see it every day, Doc, is that when you run this over normal tissue, there's no pain. There's a diagnostic tool. That's why we have this in 15 professional sporting teams. But as soon as you run it over areas of poor circulation, inflammation, arthritis, or damaged connective tissue like a tear or even a fracture, you'll be like, there's a biofeedback component where the patient's like right there. And I remember as a kid reading this magazine, Mad Magazine, in the back, you could order these X-ray vision goggles, and this device reminds me of what it, you know, like if we had X-ray visions. And we talk to the patient like, oh, we're going over the bicep tendon. Here's the transverse ligament, you know, here's the deltoid tuberosity. So as we're mapping out a chief complaint, we're looking at that anatomy and assessing it. I love that part about it. But there's also a healing component, right? So once we find those bad areas, what do we do to the energy level, Doc?
You start going up.
We turn the energy level down to more of a healing mode. If it's deeper, we have to go higher energy, but we make it more accessible for the patient to tolerate these treatments.
Right.
Great. These are supersonic sound waves. These are everywhere in nature, right? You know, There's the when a jet breaks the sound barrier, it's moving 765 miles an hour. What we're doing is literally harnessing the power of a lightning bolt and the clasp of thunder and putting it into that handle applicator. Because it's electrohydraulic, it means we have electroshock surrounded by water that magnifies these supersonic sound waves to 4.4 Mach. So 4.4 times the speed of sound that gets us to 3,355 miles an hour.